Howdy, y'all. My name is Lowell Prince, and I'm here with,
Annie Bremer.
And David Sierra.
and we are Group 22, and we did the eye. The eye is often compared to a camera, because they both have lenses and light-sensitive surfaces. Your iris controls how much light enters your eye, and your lens helps focus the light. The retina is a light-sensitive surface at the back of your eye, and it captures an image of what you're actually looking at. Then the retina sends impulses to your brain along the optic nerve, and finally the brain interprets what you're seeing. So there are three main layers to the eye. The first is the supporting layer, and that consists of the cornea and the sclera, and that actually provides support and structure to the eye. Within that is your vascular layer, and that contains the iris, the cellular body, the choroid, and the ciliary processes. And that's going to just have a bunch of your blood vessels and going to be highly vascular and provide nutrients to the other layers. Thirdly, we have the innermost layer, and that's going to be the retinal layer or the functional layer. And the retina in your eye is going to be the part that connects to the optic nerve and tells the brain what you actually see. So here are some important structures of the eye. Firstly, we have the cornea. That's the outermost lens of the eye that focuses light into the inner eye and protects it from any harmful matter. The cornea serves as a protective covering for the front of the eye and also helps focus light. Secondly, we have the iris. That is the colorful structure of the eye that changes the shape of the pupil to allow for different amounts of light to enter the inner eye. The iris allows more light into the eye when the environment is dark and allows less when the environment is bright. Thirdly, we have the lens. That's like the transparent orb within the eye that refracts light to the retina of the eye. The lens becomes thicker to focus on nearby objects and thinner to focus on distant. Fourthly, we have the sclera, and that's basically the protection um, of white outer covering of the eye.
All right. So the first disease we're going to talk about for the eye is retinal detachment. And retinal detachment is an emergency situation where the retina separates from its normal position and thus pulls away from its blood supply. And that will ultimately lead to permanent vision loss if it's not handled soon. There are three types. The first one is rhegmatogenous, and this one's the most common, and it accounts for 90% of all of the detachments. And the rhegmatogenous is retinal tears that are caused due to the vitreous gel pulling on the retina and causing a tear in it, allowing the vitreous gel to get behind it and push it out of place. And this is the most common cause of this one is aging. The next one is tractional detachment, which is seen in people who have poorly controlled diabetes or other conditions that change the normal blood supply of their bodies. And this is important because if the normal blood supply is changed, then there are going to be new abnormal blood vessels that are formed and they grow in a disorderly fashion. And once those blood vessels are, if they're not treated, then they can regress and they leave back scar tissue, which can then pull on the retina, pulling it out of place and again allowing the vitreous gel to get behind it and push it out of place. And the last one is the executive, which is caused by usually age-related macular degeneration, injury to the eye, tumors, or inflammatory disorders. And this one's just that the vitreous gel just gets behind the retina and pushes it out of place. There are no tears or anything. And the risk factors for retinal detachment are aging, previous retinal detachment, or if you have a family history, if you have myopia or nearsightedness, previous eye surgery or previous severe eye surgery, and other previous eye injuries. Okay, so the symptoms of retinal detachment are a sudden appearance of many floaters, which are different black or gray dots that show up in one or both of your eyes. There's also flashes of light that appear in one or both of your eyes. You can also get blurred vision, and your peripheral vision is gradually reduced. which can ultimately lead to your whole vision being gone. Retinal detachment can be diagnosed using light instruments and an ultrasound to get in to see inside your eye, see the retina, and see where the tear or where the vitreous liquid is, and try to get it out. And then there are 3 treatments. There's pneumatic retinopexy, which is injecting air or gas into the eye, and then once the retina is pushed back into place, you laser it or freeze it so that the tear is welded back. Then there's sclerobuckling, which is when you put a thin silicone band in the eye to support the retinal tear, pushing it back into place, and again using freezing or a laser to weld the tear back to its normal position. And the last one is vitrectomy, which is just draining and replacing the fluid in the eye so that the retina can go back into its usual position.
The other disease that we study in this project is age-related macular degeneration. Basically what this is it causes loss of central vision. So as you can see in the image here, a person with normal vision, that's what they would see. And then on the right, you can see someone with macular degeneration. They would have like a loss of image and color perception, especially in the middle. This is also the main cause of vision loss or blindness in adults that are over the age of 60. This is composed of 2 stages. There's this dry stage and then there's a wet stage. So most people are only it only progresses up to the dry stage and it doesn't go up to the wet, as it can be treated beforehand and prevented from progressing. So in the dry stage, there will be seen some yellow Johnson deposits in the back of the eye, which is called the macula, and they begin multiplying and growing in numbers, and this may start causing some vision loss and dimming lights and cause some distortion. As you can see in the image here, it causes some blurry and you can't really see the stuff around it very well either, as it becomes more distorted. And then after the dry stage, if it is not treated in time, it will progress to the wet stage. And what happens here is the blood vessels start to grow in size because they're attempting to alleviate the yellow Johnson deposits. And this happens in the back of the eye, and it causes leaking of blood into the retina. Eventually, since there's blood in the eye, then it will start scarring, and this causes permanent loss of central vision. So it's important to always be treated as soon as possible in order to prevent this from progressing into something that's more permanent. There are several causes of this disease. It's still being studied as it's very experimental still, and many people have concluded it's due to genes. So it's genetic. If someone in your family or your ancestors had it, then you are more likely to get it. There are also some habits that can increase your risk of getting it, and some of these include smoking, high blood pressure, high cholesterol, and obesity. There's also certain types of people that are more prone to get it, and this is for females, people with a lighter skin color or with light eyes. Some of the symptoms for AMD is unclear vision, so it can become difficult to read fine print or to drive. It can also cause the central vision to become less clear, so it become blurry and dark, as some people, only in some people, it causes color perception to be lost. And for the diagnosis, you can see some yellow Johnson deposits that are in the back of the eye, which is the retina. And also there are several tests that can be done to confirm that someone has it. There's the Amsler grid test, and this is composed of black and white lines. And if it appears to be missing some lines, or if they're distorted or wavy, then it can be more likely that you have it. And then to completely confirm it, you can do an angiography. So what they do in this test is they inject some fluid intravenously, and they're going to track how it stains in the eye, so they can see exactly where there are some leaks or new vessels being formed. And then for the treatment, there's anti-angiogenesis drugs. And what these are going to do is especially in the wet stage, like they're gonna stop the leaking and new vessels from forming. There's also laser therapy, which is gonna end up like killing or destroying all these blood vessels that are being formed that are abnormal, because that's one of the like symptoms of this disease, more blood vessels growing in the eye. And there are also some really cool vision aids, and what they do is enlarge the images, and this will, so people that have loss of central vision, they can see what is in the remaining vision, so in more of their peripheral vision.
So for exam question 1, we got which layer of the wall of the eye is or correctly matched with this image. For this one, it's going to be A and B only. A shows the supporting layer, B shows the vascular layer, but C does not show the choroid layer. It shows the retina layer. For question number 2, which structures matches the images? This one's going to be A, B, and C. Remember we said the sclera is the outer protection. Retina shows A, and C, the choroid layer shows C, where it's more blood vessel-y. And then for question number 3, this part of the eye regulates the amount of light entering the eye and gives the eye its color. This one is going to be A, iris. Remember, that's the colorful structure of the eye that changes the shape of the pupil to allow for different amounts of light to enter the inner eye, and it gives its eye its color. So it's going to be A. And that's our works cited. And that's it.